right, today we are going to be talking about health promotion across the lifespan for adolescents, which is going to be ages 12 to 18. So in our presentation today, we're going to be talking about the level of development using Erickson's theory. We're going to talk about what makes adolescence different, methods of communication, issues impacting communication, health promotion issues, and education topics for adolescents.
All right, so in our first slide that we have here, we're going to be going ahead and discussing the developmental level with adolescents using Erickson's theory of development. So adolescence falls into the role of identity versus role confusion. In this stage, adolescents are exploring their sense of self and their personal identity. Often they may be questioning, who am I? And kind of exploring who they want to be in the future as well. Success in this stage leads to a strong sense of identity, while failure leads to role confusion and insecurity. Lastly, adolescents in this stage are exploring their personal values, their career choices, and relationships. And their personal friendships are being used to seek validation and acceptance from others.
So just some other important things that we felt that we wanted to add to the slide would be allowing exploration in a safe environment can prevent role confusion, while independent decision-making can strengthen the confidence and self-esteem of the adolescents. We also wanted to add some key terms, one being exploration and experimentation, which is where adolescents can explore different ideas or discover their identity that is true to who they are. Another one being success versus failure, which can be defined as a stage in which the adolescent can be led into a true sense of self and more clear understanding of their place in the world. Although failure can result in feelings of uncertainty, confusion, and feeling a lack of confidence or direction. So with that, we're going to hand it off to Chris and Yehoska.
So our next topic is going to be what makes adolescence different from other developmental groups. And the adolescent population undergoes crucial developmental changes from physical to self-identity. And Yehoska is going to continue with physical changes.
Physical development, leaving your childhood body to an adult body, are both inside and outside body experiences. Factors that play a part in physical development are genes, exercise, illness, substance abuse, and intellectual development. Cognitive development, just like physical development, occur at different rates and times. Factors that may be considered are lifestyle, disabilities, past childhood trauma, behavioral health disorders, and substance usage. Emotional development is influenced by circumstances and surroundings, such as stress, identity formation, and self-esteem. Chris?
So social development or social changes are when adolescents experiment with social relationships. They begin spending more time seeking approval from peers rather than their family members, and they attempt to discover where they fit in. Independence increases, and they gain a desire to make their own decisions and have more control over their lives. Our last part of this topic is principles and value changes. With the addition of abstract thinking, adolescents begin questioning authority, forming personal moral codes, and they base their daily decisions off of moral principles. We're going to pass it over to Felicia.
So methods of communication. When communicating with adolescents, it's important to remember that it may be difficult to try to get them to open up and communicate. They are in a stage where they feel misinterpreted or unheard, but there are multiple ways for us to improve our communication with adolescents to make them feel safe and comfortable. For example, respect amongst adolescents is the most important factor, and also providing a judgment-free zone. They hate feeling disrespected or seen as little. Another example would be active listening, maintaining eye contact, and sitting down facing towards them. This shows that we fully want to understand them and allows them to see that they are being heard. Another example would be comfortability, providing comfortable space between you and the patient. For example, not standing too close and also not standing too far, and allowing a free space to speak. This can help them feel welcomed and not intimidated by us, and it's important to remember to not interrupt while they're speaking so they can fully express themselves. Last but not least, privacy and confidentiality. An example would be to ask the parents to leave the room and having the door and curtain closed. Some information may not want to be shared or heard with the parents in the room, and having privacy also increases the accuracy of information. Having the door closed allows information to stay inside the room and not heard by others. It's solely a conversation between you and the patient, and all these factors contribute to building trust and patience with adolescents. also allows greater information to be collected. And now Jacqueline will continue with negative communication.
All right, so kind of bouncing off of what Felsie was talking about, the biggest takeaway with communicating with an adolescent is going to be making sure that we're treating them with respect and as an equal and wanting to create that safe space. So some things that could affect how we communicate with them are going to be their need for privacy and their struggle with their body image issues. So they may be a little more vague and not as open to communicating with us. So some things that we can avoid to help create that safe space is going to be making sure we are aware of our expressions and gestures, because teenagers can be very attuned to body language, so they may take things the wrong way, or they may kind of read how you're coming off. We also don't want to use condescending language or any patronizing tones and like belittling them or talking down to them, because as Felsia said, they are looking to be treated as an equal. They want respect. They are wanting to be treated as an adult now. And we also don't want to use any of their adolescent jargon or slang or anything like that. We want to try to focus on them as an individual rather than just going straight into the health question interview. So as we stated, biggest takeaway, just treat them with respect. And now I'm going to pass it off to Paloma and Joyce.
So for this slide, we have health promotion issues for adolescents. According to the World Health Organization, the leading cause of death amongst adolescents is due to unintentional injuries, particularly traffic accidents like motor vehicle crashes, pedestrian fatalities, and also drowning. So more than 40,000 deaths a year occur due to drowning, and 75% of those being men. This also includes interpersonal violence, which is a more broad term referring to physical assault, domestic violence, and gang-related activity, accounting for nearly a third of male adolescent deaths. This also includes self-harm, like suicide, specifically amongst older adolescents above the age of 15. So although this top list includes the leading causes of death, there are also several risk factors that can affect adolescent health, increasing the likelihood of adolescent illness, disorder, and disability. And now on to Joyce.
As my partner said earlier, there is a lot of risk factors that impact adolescents, which includes substance abuse such as alcohol, marijuana, tobacco, that can lead to physical, social, or emotional harm, and it may lead to addictive behavior towards the adulthood. And another one will be the mental health problem such as depression and anxiety, which often go untreated and undiagnosed until adulthood. People will never know. There will be a situations and it will be affecting them with their everything that will affect their neurologic problem. And I have another risk factor that will be premature sexual activity prior to the sex education or puberty. And that relates to 8 and 13 years for the girls and 9 and 14 for the boys. Complication related to early pregnancy in older adolescents. And another factor includes age-related diseases such as sexually transmitted disease or infections, lower respiratory tract infection like pneumonia, tuberculosis, and many more. And I have another risk factors, which is malnutrition, such as unhealthy eating habit that can impact physical and mental development with adolescents. And last but not the least, I have a lack of physical activities due to environmental factors, sedentary lifestyle, or obesity that can affect this. I'll handle the next slide to my colleague so they can read out for that.
All right, so the last thing we're going to be talking about is educational topics for adolescents, for teenagers and young adults. And we really wanted to kind of apply everything with communication and just make that an important note. You do have to be respectful when you're talking to teenagers and young adults with all of these things, because they can view a lot of these things as signs of their own independence, and they could feel very defensive in that way. They can feel very shy to talk about these things on their own, and they could be very avoidant with all of these. The three topics Kelsey and I chose were substance abuse, driving safety, and sexual health. And if I could just talk about substance abuse, the biggest thing, and that's with alcohol, that's with stimulants, that's with nicotine, that's with marijuana. The legal ages to be taking all of those things is 21. Your brain doesn't fully develop until you're in your mid 20s, like 25 or 26. And the younger you are, the more likely you are to be susceptible to addiction, to depression, to those different neurological disorders. And that could be something that a lot of young adults aren't really aware of or they dismiss. And that's just a really important thing I think anyone needs to know about. That's something you could do to yourself when you're 21, when you're 18, when you're 16. And that's something you could never get back for the rest of your life, is your own mental health or your own cognitive health. If I could pass the other two topics to Kelsey.
Okay, the next topic that we chose was driving safety. Adolescents should be educated on the dangers of texting and driving. The top 3 causes of death for this age group are accidents, suicides, and homicides. And bouncing off of accidents, the top cause of death for 16 to 24-year-olds is motor vehicle crashes, with distracted driving from things such as texting and talking on the phone being a large risk factor for these crashes. Teenagers specifically are especially susceptible to distracted driving due to things like peer pressure, like wanting to respond quickly to friends and significant others, an immature ability to think about consequences due to their brains not being fully developed, and a feeling of invincibility, like it could never happen to me. The use of drugs and alcohol also significantly increases one's risk of being in a car accident if taken before driving, with alcohol and marijuana being the leading causes of intoxication-related crashes. And then the last education topic we picked was sexual health. Adolescents should be educated on safe sex practices to prevent unwanted pregnancy and STDs or STIs. Providing comprehensive sexual education can significantly reduce unintended pregnancies and sexually transmitted diseases such as HIV, chlamydia, and gonorrhea. And then certain STDs have been linked to infertility if left untreated. For example, chlamydia is a well-known risk factor for female infertility. And then that is the end of our slide.
All right, that is the end of our presentation today, and here are our references. We hope you guys enjoyed. Thank you.